Now, in Libreville, the Gabonese capital, around 100 health, environment and finance ministers or their representatives from across the continent are taking part in a major health and environment conference. Organized by the World Health Organization, WHO, the conference aims at addressing health issues on the continent stemming from the environment. Now, 23% of premature deaths in Africa, it says, is attributed to environmental causes, the highest for any region in the world.
That's right, Jerry, and these environmental causes are diverse. Global warming, the most talked about at the moment, but also air pollution, unsanitary conditions and access to toxic products such as pesticides. According to the WHO, more than 2 million deaths are caused by the environment.
Thank you. Matshidiso Mueti is the Africa Regional Director for the World Health Organization, WHO. We spoke to her in an interview and asked her how bad the state of environment in Africa is affecting the health of people on the continent.
The environment has a profound impact on the health of people in Africa, as it does all over the world. It's through the air people breathe, if it's contaminated, through water and sanitation, and through climate change. And it affects, in Africa, we estimate almost 1 in 4 of illness in the region.
The WHO chief also talked about the close link between the environment and food security, or survival for that matter. She spoke of how the WHO was approaching this complexity.
Oh, in 2 ways. First of all, through global warming. And this primarily is through then the increase in the propagation of disease vectors, including mosquitoes. And we've seen the upsurge in some regions where there had been progress in prevention and in working towards elimination, the resurgence of malaria. We have seen the reappearance of dengue in areas where it had stopped being a problem for many years. We have also seen, including in some urban areas, partly due to the change in the climate and the propagation of the vector, yellow fever manifesting as a problem again in the region. So that's one way in which, so infectious diseases, one way in which climate change can have an impact. At the same time, we have seen extremes of weather, either through rainfall and flooding or through droughts in some countries also have an impact on health. If there is flooding, water everywhere, that can affect, first of all, several aspects, including contamination of water sources, and diarrheal diseases, including cholera, have become a problem in some cases in areas where there's flooding. In addition, of course, we've seen the devastation, the destruction of housing, property, the need for people to move, the displacement of populations as a result of some flooding. And people then are living in camps or in circumstances where their health is at risk, either because health services are not available in that context, or the context in which they're living also aggravates the risk of the transmission of diseases.
So much impact of the environment on health there she was talking about. And she also did speak about the ongoing conference. Let's take a listen to that.
I think the conference really is coming at a crucial moment in a very positive sense. So it's 10 years since we held the first conference here in 2008, and I believe we have done a lot. First of all, we've established within the United Nations a very strong partnership between WHO and the United Nations Environment Programme. And together we've managed to work at the country level with ministries and sectors of health and environment.
Matshidiso Mueti, the World Health Organization, WHO's Regional Director for Africa, speaking there. And that conference called the Health and Environment, Shaping a Better Future Together in Africa, concludes on Friday, November 9 in Libreville, Gabon. If you're just joining us, you're watching The Morning Call, and we are live for you from our studios here in Pointe-Noire, Congo, Brazzaville. And for the very latest stories from across the continent and elsewhere, please log on our website, www.africanews.com. Now, still to come on the program. As we told you earlier, voting is currently taking place in Madagascar. But if there is anything the Madagascar people would vote for rather than other candidates, it will be for jobs. More than 3/4 of the population in Madagascar live in poverty. We hear some of their expectations for their life and the country's economy. And in sports, there is ability in disability, they say. Currently underway in Mexico is the 2018 Amputee Football World Cup. Over 20 teams are taking part. We'll bring you some of the highlights from the tournament. All of this plus much more when we return after the break. Stay with us. Barbara and I will be right back.